How can you have a patient on your admission bed? First day, second day, third day, fourth day. Patient does not know what diagnosis she's been treated for. Patient knows nothing about why she's in bed. Relatives are all blank.
So and
you are treating.
They will now say...
Patient now dies.
Of course, they don't know.
I will beat you if I'm the patient relative.
Hello and welcome back to your favorite show, Diagnosis, the one place where we tackle, as the new one, we tackle the issues, the very many issues that plagues the Nigerian healthcare system, and we put a twist to it by trying to prefer solutions and not just focusing on the problems. I am so grateful to you guys for last week. I looked at all the comments from Instagram to Spotify, and I was just really happy with the support, the turnout, and the support you guys showed the nurses for our previous episode too. I really want to say a big thank you to you all. You are the reason why we are here. You're the reason why we do this. We're all working together for a better healthcare system. So today we're going to be continuing our topic about the violence against doctors, why it happens, and what exactly is our parent body, their enemy, doing with regards to this problem. Because this is not the first time, this is not the second, and I hope that as we keep talking and preferring solutions to this and finding out the root causes and, talking about ways to solve it, it could be the last time we would have such a conversation. And with us today is a fan's favorite, Popular's Delight, the people's choice, Dr. Olofin. Yay! Hello, Dr. Olofin.
When you say all these things, I get a bit confused. Like, are we some kind of beast?
Dr. Olofin, you're the people's choice.
Like, I feel like using my fingers to cover my face. I'm a bit shy. But I'll try to compose myself so that...
you should not enter your head.
Yeah, if I start to say things that will only make people happy and not really...
No. These people, they want a balanced diet. So come with some...
Because I might be throwing some jabs,
To us, we want those jabs.
Back and forth. Anybody can collect,
If you do anyhow, you see anyhow. Give it to them.
Right in front of the counter.
Where are today?
Let me my best day.
All right. So, Dr. Olofin, you heard the topic, right? Violence against health, not just medical doctors now, healthcare workers. This is not the first time we'll be hearing about a doctor being slapped or a nurse being beaten. The incident in late January when a political leader in Lokoja went to FMC Lokoja and started destroying the A&E, trashing the A&E, and so much so that the thugs that he brought with him took the gun from the chief security officer and started shooting at people. Why? Because he lost a patient. He lost a relative. I mean, I understand how painful that can be. I'm not a wicked person. I try not to be. Empathy, right? But why? It makes zero sense that would be that somebody that has lost somebody, instead of grieving. Well, there are different phases, right? Some people can become violent with their grief, but it's becoming such a problem. So
I agree with you.
Yeah.
It's a real problem now because going on the track of what the real cause of this violence in our hospitals or against the health professionals. I'll talk about this in three different dimensions. Definitely in surgery, we talk about the environmental factors, the doctor's factor, patient factor. So here, I think I'll follow that premise to discuss this. There is the environmental environmental factors,
yeah.
The doctor's factors, and the patient and relatives factor. First of all, nobody has the right to lay a hand on me, not even at my workplace, even outside my workplace, without my permission.
So with your permission, they can beat.
So if I say beat me up and you beat me, it's fine.
Okay, so for people that used to say, come and beat me,
come and beat me, and I come to your father's house and beat you up, you don't have a case, provided you have it on record.
Yeah.
Go to court that he said I should come, and I volunteered him that privilege of beating him up. So that's fine. But in this case, no matter how angry you are, in the workplace, the work environment, even if two two workers can be fighting.
Exactly. Professionalism, at least.
So, yes, grievances, you are angry at a particular situation, your expectations are not met, you are angry. Even if your nature is to be hot-tempered, you still don't have the right to beat me up. No matter what, no matter the circumstance, even if you are dead, even if the Baba tells you in the village that when you get to the hospital, just catch a doctor and beat him up and you'll be healed, you still don't have that right to touch me. And you touch a health professional, or when we put this thing together, some people feel like, let me just say, you touch a doctor, you have touched the old doctors in Nigeria. That's the way I think of it.
I love what you just said. You touch a doctor, you've touched the whole doctors in Nigeria. But you do that, and it's just another regular gist that they gloss over. The people, there's outrage. Let me not call it full outrage, but there's outrage on social media. Hashtag violence against doctors. Hashtag what is NMA doing? Hashtag. And the hashtag gets buried under another hashtag.
Because
so what are the doctors doing against the NMA?
Wait, let's go stepwisely. Now, even your colleague, a doctor has been assaulted, possibly in the accident and emergency. And your own colleague in another arm of the hospital is working.
They should stop what?
You don't need an NMA to come and tell you what to do at that point.
Dr. Olofin, you know that these things are not as straightforward as that now. No. You quit your job, you stop working in solidarity, and then they now come for you too.
That's in that hospital at that point, the doctors will definitely have somebody there is a doctors forum, there is a branch of ARD in that hospital, domicile in that hospital. There is someone who represents ARD, they represent the doctors forum in that hospital.
Nationally.
So just come together immediately. That should be a halt.
So that's one solution.
That is to start with. You can't beat a doctor and expect things to just continue like nothing happened. Something has happened. Okay, like I tell my house officers back, even till now I tell them, at 12 midnight, you have a difficult patient, you have a challenge, whether I'm on call or not, whether I'm in your unit or not. You can call me and tell you do this, do that, do this. If I'm on call, definitely I'll come. If I'm not on call, I can tell you what to do. But if somebody assaults you at 3 a.m., you don't need plenty stories. Call me, I'm coming.
Whether you're on call or not.
But please, if they slap you, do not respond with a slap. They insult you, do not insult the person. You don't know who to call? Call me. I like trouble. I'm coming.
That's one doctor that is having the backs of.
Now, if everybody would behave this way, the populace will know that when you touch one of these people, they will react. There will be consequences. That to start with. Before you go to NMA, NMA will do more of advocacy. They will keep liaising with the government. NMA won't provide security for the hospital.
Why though?
NMA is working on this matter. They are doing what they can do. Advocacy, most especially. NMA won't directly provide security to the hospital. Nowadays, please, focus a lot on who is to do what directly. Who is supposed to give you the water you want to drink, not who is producing the water. What is the hospital? What has the hospital done? What has your head of department done?
In fact, I saw a tweet, right, where somebody said that there was a case, I can't remember the place, I think it's in Benin or so, but the person was working and then a patient relative died. And they now came in, who is the person here? Who is the person here? They now had to call the girl that, don't come to the A&E, they are looking for you. Apparently, they went to meet the MD of the hospital, who told her that she should go and appease them. She should go and say sorry. The MD had even given them her location.
Now, is that a private hospital? Or
private hospital.
No, private hospitals where the sole desire is to make profit. The game is different. Private hospital where the MD wants you to kiss the ass of a patient so that you don't lose the patient, for crying out loud. I'll kiss kiss anybody's ass.
He will kiss no damn.
I work professionally, and if that doesn't meet your standard, you have the privilege to seek professional
redress
anywhere in the world. There's no problem. Now, another point we should always also mention. Let me go to the environmental factors. In our culture, in this part of the world, everybody with a level of authority over anything
wants to
becomes the Lord.
Yeah.
Where the gate man can just stroll around and refuse to open the gate for you.
Mr. Peter Afebabalola University, that man at the gate.
So, some people, like you mentioned, maybe senator or related to senator, they lost somebody in the hospital, they want to show power.
How would that bring the person back?
Oh, we are not going to shut down the hospital. No. But we can just stay safe. The environment is not safe at that moment. So it's not shutting down, it's not down-tooling, it's not strike. No, it's staying safe. Staying safe means staying away from the environment where you are not safe. And that hospital at that moment
is a hostile.
Exactly. So you just call your doctors, please. Government, we are sorry. We want to work, but
it's not safe environment.
Exactly. So let's be safe.
So that's a legal way
to make sure the environment is safe. One, and the person who has assaulted any of our members has been brought to book. Two, there may be one or two other things, and we can come back to the environment and work.
I love that.
We are not. We want to work, but make the environment safe.
I feel like, and I think this needs to be out there for people, because the problem now, and you really touched on that, right? You see these things happening. You see a lot of people meting out violence. Like, I mean, when was it 2 or 3 years ago when a doctor was held at Asokoro district, right? She was held and they stripped her naked.
No, that was in Maitama.
Oh yes, it was in Maitama. And they stripped her naked. And I didn't see, I was angry and I was in FMC. I didn't see what was done.
All right, now let's go to the third one. The third one now involves you and I. How can you have a patient on your admission bed? First day, second day, third day, fourth day. Patient does not know what diagnosis she's been treated for. Patient knows nothing about why she's in bed. Relatives are all blank.
So
and you are treating,
they will now say
patient now dies.
Of course they don't know.
I will beat you if I'm the patient relative.
This is not funny, but the way you're delivering it is killing me.
That is it. In many instances where you see the people who are supposed to defend you folding up, coiling up in their chair, they are trying not to tell the world what you have done. And they don't want to roll in the mud with you. Communication. Bring your patient up to speed at every time. See.
Patient.
On admission, you don't have a diagnosis. We are working on diagnosis, but we have provisional diagnosis. We are thinking this could be the problem, this could be the problem, that could be the problem. But as soon as we make a diagnosis, we'll let you know. And as soon as you do, you let them know. The patient has a right to even what treatment you are giving. You have a surgery. You've come out day 1, day 2. Patient does not know what you found. Patient doesn't have a clue about his prognosis. A case that you think patient will not last for another 24 to 48 hours. You are giving them hope. Patient dies. You will wake that patient up.
You'll definitely be blamed.
Our people hoard information. They hoard information. I've seen many patients referred to my hospital who have no clue about what the referral hospital was managing.
Patient-centered care in the mud.
And you want enemy to stand gidigba and be fighting such cases. You will just see enemy. You just see your people you think should fight for you. They'll just go radio silent. We'll just be whispering, oh no, that doctor no try. You now want us to go and stand in court for you. You answer your father's name.
That's good.
But we all have a role to play here. You just don't blame everything on the patient. But if you do everything you need to do,
means you communicate.
When they tell me a patient is angry at me, I tell them, I'm coming. Let them wait. so that they can express their grievances. Because I know you can't take me to anywhere and find a fault. I beat my chest to this. I do I do like a town hall meeting. I ask for everybody who is responsible, who should know about this patient. I ask the patient, do you want this person there? He said yes. Do you want this person there? I carry a chair. We sit down. We discuss. Keep the people you think might beat you or might want to go to court tomorrow, let them be in this meeting. You talk. Let everybody have information.
So when they go to court and they ask them, were you or were you not informed? They can say,
except you want to have amnesia suddenly.
So I mean, lovely episode, because we have talked about very key, things here. Number one, we doctors are also to be blamed for patients getting angry. The lack of information will build ideas in their head. And some of us, in a bid to assuage them, we will now be lying to them about the prognosis. You know that a patient is not going to make it. I mean, we as doctors, we know when somebody will not make it. You can tell. You can tell. So instead of us to tell patient, and let's tell the truth. I mean, nobody will beat you. You're not God. We've been given the grace and the intelligence and the skills to be able to help people. But as they always say, doctors treat, God
heals.
Saves. I mean, God heals. Yeah, all of that. So inform your patients, communicate. Communication is not just important in a relationship. It's important in patient care. It's important everywhere. So communicate with your patients. Number two, doctors must support themselves. If it has been heard of that a doctor was beaten in your hospital, I don't think there's any reason why you should continue to do anything there. Stand in solidarity, like he has said. Everybody wants a better environment, but nobody wants to build a cat. And it's so annoying in this country. Somebody would think if they stand down, they will be held responsible. Meanwhile, my mother would always say, it's even a common saying, you take a broom out of the bunch, you can break it easily. But when the bunch is tied together, it's hard to break that broom. And we need to understand, we need to get this collective good mentality if we ever want to help ourselves. And what was the last one? The environment. I think that feeds into the whole, being in solidarity and the rest. So these are the solutions for this problem. Dr. Olofin said I should not be blaming enemy like that.
Let me taking it easy.
Me, I'm very angry at enemy for that building levy. Dr. Olofin, what are they building?
For that building levy.
Mm-hmm.
I don't know. I can't. My annoyance on the scale of 1 to 10 is like 15.
All right. We're going to have a special episode to discuss the NMA building levy. Where does it go? Where is the building? Who are the producers of the cement? Who are the masons?
The one that even annoys me most is the fact that they say, okay, we are 10 years in medicine. My building levy increased.
I'm screaming. Dr. Olofin, what?
And apart from the fact, it's not even just that it has increased. They explained why at your year 9, your license fee should increase by 10,000. Then why should my building levy to increase? Building levy is a one-time payment.
You know what? Stay tuned for next episode. We're discussing the NMA building levy. I think I'm going to have the ginger to attack them. We're coming for you. I know who you are, NMA. I know you. I know your story.
I don't know what you're talking about.
We're coming. Until then, we remain your favorite show, Diagnosis. Please don't forget to like and subscribe. Leave your comments. Follow Dr. Olofin. I will put his handle here. Follow Dr. Olofin and ginger him, because we need to talk about this building levy. I don't understand what they are building and why your fee is increasing at year 10. This is not right.
No, it was built though.
Until then.
We'll have a room in that apartment.
See you guys next week. All right, guys.